Joining me right now, we have forensic psychologist Dr. Chris Mahandi. Chris, welcome. So based on what we know so far, is there a profile of Mangione that explains what may have led him to brazenly killing Thompson on a Manhattan sidewalk?
Well, I think what we've seen here is that he had a grievance. Grievance is the foundation of all these kinds of targeted violence. And his grievance stemmed likely from what we've learned about him, his own health issues with his back that were life-changing for him, and his frustrations with that and the way it changed his life. His friends and people who knew him said that there was a substantial turn in his personality related to that, the things he was capable of doing, not capable of doing. That led him into different kinds of written materials that were against the healthcare industry and kind of the identified problems there, a couple of different publications in that regard, and likely other places that would have further made extreme his viewpoints about that. So there's a constriction, of his viewpoints there. So we've got a guy with a grievance who likely had a significant change in his mental state. The fact that his mom filed a missing persons report November 18th, and he was off the grid since July, and suggests that he's had a substantial change that could reflect a deteriorating mental state, which could be part of what has fueled his feelings of grandiosity and his sense about the need to, quote, martyr himself and see this as a mission, because I think that's very much how he sees himself.
And let me pick up on that, because his murder has sparked thousands of Americans to express their fury at the U.S. healthcare industry. And that's turned him into some kind of an anti-hero for taking action against a system that profits from denying care to patients. Others are shocked over the support that he's getting for vigilante justice. In fact, here's what Senator Elizabeth Warren said about it on MSNBC. Take a listen.
When you turn this into the billionaires run it all, is they get the opportunity to squeeze every last penny. Yeah. And look, we'll say it over and over. Violence is never the answer. This guy gets a trial who's allegedly killed the CEO of United Health. But you can only push people so far. And then they start to take matters into their own hands. Yeah. We need regulation, in part, to rein those guys in.
Now, let me add that Warren later clarified her remarks, saying that there was never a justification for murder. But, Chris, we are living in a moment of intense populist rage against the government, against income inequality, against elites. Has this led to public sympathy for Mangione?
100%. There are so many people that have their own grievances against the healthcare industry. When you look at United Healthcare, for example, they are the highest in terms of denials. That is no justification for violence, but unfortunately it's touching a chord. And you combine that with the attention that he's getting, which, a lot of people identify with him. This is definitely the wrong thing to do. But there are many people that identify with this. And then you have the potential for what we call contagion or copycat incidents, like we've already seen people making reference to it and getting themselves legally jammed up. The next 2 weeks to a month after a high-profile incident like this, you have a great likelihood of having copycat events with people that are inspired by it. And because this is such a significant issue, the impact of this could be much longer than that, where you have people identifying with him for years to come. And that's an unfortunate thing, but we've seen it with things like Columbine and so forth. And he himself, this offender, identified with Ted Kaczynski. So the media need to be very careful about how they present him and very careful with the messaging so that they are not part of the problem, but part of the solution.
Thank you for that advice and your assessment of all of it. Chris Mahandi, thank you.